Hello, I'm Dr. Wayne Jonas. As a family physician for more than 40 years, I've had countless patients come to me desperately hoping to alleviate their chronic pain. Often, chronic pain begins with an acute pain event. The pain can develop and intensify to become chronic pain, and sometimes there's a clear cause of the pain, such as arthritis. But other times, there isn't a specific trigger or an underlying illness or condition. According to a 2021 survey, more than half of Americans experience chronic pain, with nearly 3 in 4 saying that they're in pain every day. Among young adults, nearly two-thirds report suffering chronic pain, with most of them saying they are in daily pain. Those suffering say their quality of life would improve if they were able to better manage it. But many do not even know what type of healthcare provider or what kind of interventions might best help them with their pain. In my book, How Healing Works, I shared about how to engage the body's innate healing capacity. You do this by taking a whole person approach. Pain is not just in your body. It is also in the mind and can affect your relationships, your work, your sleep, and your mental and emotional health. Pain, especially chronic pain, affects your ability to enjoy life, focus on what you're doing, and what's meaningful for you. I had a patient, I'll call her Margaret, who suffered chronic back pain. She wasn't sure how it started. Maybe she lifted her grandson wrong, or it was the extra hours on her feet at her shop. Her doctors prescribed medications and physical therapy. She had x-rays and an MRI, which revealed arthritis in her spine. Then she developed intense sciatica, a pain shooting down her leg. She received an injection for it and a prescription for an opioid medication to take when the pain was unbearable, which was often at night. Then other medications followed, ones for sleep, for nerve pain, and finally to help lift her mood. By the time she came to see me, she was on 5 medications, including a daily opioid. She could no longer exercise, had gained 50 pounds over 10 years, was miserable. When she didn't take her opioid, she became agitated and irritable, classic signs of opioid dependence. My goal in sharing Margaret's story is to help you avoid the 10 years of misery and pain she experienced. People with chronic pain need 3 things that are all part of whole person care. Number 1, they need a healthcare team that works together and shares information and approaches. Second, they need non-drug approaches to help improve function, cope with the pain, as well as reduce it. And third, they need help managing the medications and their daily lifestyle with the goal of getting off or reducing opioid use. My experience and research show that such a whole person approach is the best way to help a person's pain and to empower that person to take control of their own path toward healing in a permanent way, using a trusting relationship with their healthcare providers. With chronic pain, the amount of pain you feel or how long it lasts might be greater than the damage to your body. In other words, your pain might be more severe or longer lasting than the injury or the illness itself. Your doctor might be able to fix the injury and illness, but not the pain. If so, the purpose of treatment might be to change from fixing a problem to healing you as a person. As physicians trying to relieve suffering, we are too often failing. Our focus on pills and procedures are not really working in the long run for many conditions like chronic pain. And rather than addressing the fundamental question of whether these treatments help to stop chronic disease and inflammation or maybe even reverse it. Chronic pain is multifactorial, multidimensional, and so there's no magic bullet cure. It is not just a body thing, it is a mind-body thing. So we must treat it as such. Psychosocial stressors, emotional trauma severely undermine the person's ability to recover, while also increasing the risk that the pain will persist even after an injury heals. This means that merely prescribing a pill or an opioid, for example, for chronic pain cannot get to the root of the problem and might even create addiction. We have a death toll now of more than 100,000 people a year from chronic opioid use. Medications have their place, but they cannot be the only solution. We need an integrative approach. As I've said many times, we do not have an opioid problem in the country, we have a pain management problem. In my practice, I have shifted to creating a personalized treatment plan that works for each individual patient's life, their resources, and their goals. I've changed my conversation with patients from asking only, what's the matter with you, to asking, what really matters to you, to put that in the center. To support and educate clinicians using a whole person approach, I've helped work with Tufts University to develop a free CME course for clinicians that describes ways to deliver effective pain management. Over 4 modules, care providers learn how to move from conflict to collaboration with patients, to explore expanded options for treating chronic pain, and to discover ways to motivate and energize patients to take control of their own care and decrease their opioid use. During my patient visits, I find that patients are usually open to managing their pain by eating healthier, exercising, trying massage therapy, acupuncture, yoga, physical therapy, and mindfulness-based stress reduction techniques or meditation. Healing can happen even if doctors cannot cure or fix your condition. Healing is the process of becoming as healthy and as well as possible, physically, mentally, emotionally, and spiritually. In other words, attending to the whole person. By focusing on whole person health care instead of symptoms only, we can address the root cause of pain and engage patients in their own personal path to healing. Thank you.